Good morning and welcome to Industry Insights. My name is Gethin Roberts from Iterate. We're a purpose-driven product design consultancy based here in the UK. And today I'm here with James Priest from Biofrisk. Good morning, James.
Morning, Gethin. How are you?
Good, thank you. Good. How are you?
Yeah, I'm busy, but good. I'm looking forward to the Easter break, I think.
Good. Yeah, me too. Me too. So Industry Insights is actually into its second year, and you were one of our very first guests that we had on the show. So it's good to have you back.
Yeah, I'm glad I had the opportunity to come back. So yeah, thanks for having me, Gethin.
You're welcome. You're welcome. So I'd like to start by firstly congratulating you on and your team on winning two European Product Design Awards for the Dose Doctor recently.
Thank, thank you, Gethin. I think it was a little unexpected, but I think without tooting our own horn too much, very well deserved. So I think we have a lot, to talk about later in the call about your involvement in that success. But yeah, it was certainly vindicating to put that much effort in and start, seeing people who
Absolutely.
weren't involved in the project start to recognize the benefits of it.
Yeah. Definitely, definitely. I mean, by such a prestigious design community, which we can come on to in a second. But firstly, what is the Dose Doctor? Can you explain? Can you explain what the product is? What problem does it actually solve?
Yeah, absolutely. So, Dose Doctor, which I have here,
Ah,
solves a,
yeah.
a, a very tangible problem. And I think it's that
Okay.
busy people can make mistakes. So medication, errors are a pretty profound kind of mistake. But in the UK, they're fairly ubiquitous. There's 237 million that happen in NHS England every year. And the risk is typically a lot higher for the use of liquid medications because they're used by very vulnerable patient populations, like the children and the elderly. So, Dose Doctor is really a careful balance between increasing or adding layers of safety without impacting the usability or the convenience of use. Essentially, it's a high durability anodized aluminum dispenser, a set of reusable and refillable cartridges that can then
Hmm.
be stored in a lockable storage container. Um,
Interesting. Okay.
Altogether, that gives us a solution that, one, makes it easier for adults to prepare and dose medication for children. But most importantly, where we see a lot of the medication errors and overdosing opportunities is unsupervised access to medication. So it's a careful balance of those two user needs that then result in this really innovative product.
Okay. So, it clearly sounds like that product does solve a clear problem, but how did you actually identify that problem in the first instance?
So it was one of our collaborators at the time. They actually had a very lived experience. They had a
Okay.
very young child, were able to, sort of step out of the room, left them with unsupervised access, not, intentionally, but they had unsupervised access to quite a strong adult opioid medication.
Okay.
And unfortunately, they were able to overdose themselves. Now, fortunately, they brought their little boy to the hospital. He had a stomach pump. There were no long-lasting consequences. But what this really set off in our partner's mind is, how do I prevent this from happening again? And it was one of those really lived experiences of, this is happening to me. I
Hmm.
wonder if this is happening to other people. And that's when we
Hmm.
really started playing around with the idea, well, there's obvious ways to make medication really hard to access, but
Hmm.
that impacts the convenience that we want in our day-to-day lives. So it was a really interesting problem, a really dynamic problem, where we
Hmm.
had to balance those two worlds. And that's where I think we can talk a little bit more about the project that we were both on together, but how
Hmm.
we really took that design hypothesis and tested it to try and get to the solution that we are at today.
Yeah. So what is the scale of the problem? Because you talked about a very sort of harrowing instance and that kind of created the opportunity for this. But is it quite common? If you think about it globally, how big of an issue is this?
Well, exactly. I think there are tens of millions of incidences in the US. And I think
Okay.
importantly that then correlates to hundreds of thousands of instances with children going to A&E departments or being admitted to emergency care because
Mhm.
either they're on another kind of medication and there's an adverse drug interaction, or there's the bigger problem, which is that this happens at home. 9 out of 10 incidences will happen in the parent's home, and I think we can all admit that we're not nurses, we're not doctors. We are trying to do the best with what we've been informed how to do. And I think that's a prime opportunity for where mistakes can happen.
Hmm. Yeah, yeah, and being a parent myself, I know that you can be quite beleaguered at 3 o'clock in the morning when the child's been crying all night. So it might it might seem like a silly mistake, but it's also an easy mistake to make, I think. Okay, so what I'm keen to understand, James, is the importance of user feedback, consumer feedback in the development of a product like this. Can you talk a bit about that, particularly when you obtained that feedback? Was it at the very early start of the project, later on down when you had more physical products? How did that interaction work?
Yeah, sure. I mean, this is something that I think has been quite an important way that Biofizz works. We've all had experience designing or being involved with the development of projects and products where, we had a concept in mind and we just wanted to make that. And what we quickly find out the moment is that you show this to a user or a customer is that they have a almost entirely different set of experiences that leads them to interpret the product in a different way. So with the Dose Doctor project, we wanted to make sure that user feedback was front and center. We wanted to make sure that we were always testing the design hypothesis, but we were never married or wed to a particular form factor or the way it looked or the way it dispensed. We knew the problem statement and we were very ready to play around with how do we solve that problem. So the project itself was actually structured quite dynamically. There was ourselves at Biofizz with the initial design concept. We invited Iterate, yourselves, Gethin, and your team
Hmm.
to be our essentially product development side of things. But we also invited a collaborator called Martin from the Listening Labs, who was our kind of user
Yeah.
research and user experience group. And I think what worked really well on that project is that we had an opportunity then to from ourselves, come up with the new product specification, give that to yourselves to manifest, to prototype, and to give us something tangible, which we can then put in front of, a user group with Martin's recruitment experience. And what we ended up with, I think, over the course of a 6-month project was maybe 4 to 5, really responsive, really quick design cycles where we started with multiple design concepts and we narrowed that further and further down into what would become, I think, our lead concept or our lead prototype. So it was really, really exciting to see where we started and where we ended up. But the way that came about was because we were purely focused on right, what is going to be the best solution for our customers. So that importantly, that was front and center, and that was the entire focus of the project. So
Interesting.
yeah,
So it sounds as if the user input really shaped the direction of the product in the sense you say, started over here and ended up over there, and the
yeah.
solutions were very different as I know. So what would you say to inventors or businesses that are maybe not involving their customers in the product development process?
I would say it's a very humbling experience when you take what you think is a very honed idea, very personal idea, and you give it to a total stranger because they have a knowledge gap. They will
Yeah.
completely misunderstand why that feature is important. They will completely misuse the product. And I think what's important for first time innovators to understand is that your idea is good, but it's certainly not perfect. And
Mhm.
customers will help you get as close to perfect as you can possibly get. So do it nice and early, get that feedback, front and center, because I think that's importantly what's going to get you into the market. You might not have a perfect product, but you'll certainly identify that MVP, that minimum viable product definition that
Mhm.
you can then, maybe generate your first revenues from, and that becomes the foundation from which you can develop the product that in your mind maybe you want to develop. I
Mhm.
think those are very two important distinctions that I would try and communicate to product developers.
Okay. Okay. Yeah, interesting. Okay. So as we mentioned at the start, the product has won 2 European Product Design Awards, and I think the categories were health and medical products was one of them, and the second was baby and maternity safety products.
Mhm.
What do you actually think made the Dose Doctor stand out to the judges?
That's a good question. I'd love to actually, see what their feedback was around those two particular concepts. But I think, as with all good innovation, it takes an idea that I think people have already decided, has no more innovation left in it. We're all very comfortable with the cowpole syringe or the
Yeah.
dosing to spoon, and there's no need to change that. I think what might have been refreshing from their perspective was, this is an idea that looks like it's completely finished, but I think being able to identify in our use case, yeah, this is still happening. The solutions are not entirely fit for purpose in all scenarios. Therefore, there must be something here worth iterating. Just to give a shout out to one of your design engineers, Matt Beamish in particular, he was very, very good at, once we had our idea, I think he made it look, for lack of a better term, stylish, making or looking at trends that, were shaping the industry. And, is this a color palette that would appeal to a young family? Is this something that you wanted to have on your shelf? So it was I think it was a combination of, we had a really strong, argument for why this needed developing. We then had a really strong use case for, the aesthetics and how this product looked and felt. And I think altogether, it really looked like a well thought out solution. But yeah, like I said, we'll be really interested to see what the EPDA actually thought, and maybe we can
Yeah.
catch up with them in Venice later this year at the
Well,
awards ceremony.
yes, that's what I was just thinking. So the award ceremony is later this year, so that would be definitely a good opportunity because they don't provide formal feedback like
Mhm.
some other competitions. Okay, so what's the plan? What's next for Dose Doctor? Are you looking to take the product to market yourself, license the intellectual property, engage, big pharma companies? What are you looking to do now with this product?
So I think, if you'd asked me this before we started the project, I would have mentioned a very conventional, look, we'll raise some money, we'll go out to market, and we'll see if it sticks. I think, for better or worse, the investment landscape is a bit challenging at this point in time.
Yeah.
So we've considered a bit more of a bootstrapping approach where we have I'll call it a, near to high fidelity prototype that's been really good for, garnering attention and allowing us to get it in front of people and having a very tangible idea to work from. But, we're considering going to market ourselves, maybe using some sort of additive manufacturing to get us off the ground, at least so that we can get a small pool of users to give us feedback on how it works in the field. From there we can maybe see a kickstarting campaign, but not a company focused, but a product focused.
Hmm.
Again, just so we can start engaging with users and having some really market led feedback as to what's working, what's not, before we
Hmm.
invest in a injection molding tool or go a little bit further. I think like I say, for better or worse, we now need to be considered, heavily with costs. We can't invest that much and take the risk. We need to be certain that this has a place in the market. And, our strategy is allowing us to test that sensibly, I think.
Interesting. Yeah, absolutely. I mean, what you're talking about there, we're seeing that more and more across the industry at the moment with global disruption in supply chains and political disturbance that lots of the companies that we are working with at the moment are choosing additive manufacturing as their production process. And I think it's possible now. It's possible now. I think the default was that businesses would assume that their product had to be injection molded, and the stumping up the upfront costs involved in doing that. But additive manufacturing, as you say, is more of a lead in to be able to produce smaller volumes, to be able to get your product to market much more quickly. So I'm really pleased to hear that you're considering that as your production process. Okay, right. So what I'm keen to kind of go on to now, James, is really understand a bit more about Biofizz because,
Mhm.
as I said earlier, you were one of our very first guests on Industry Insights, and I know that Biofizz has changed a lot over the last sort of 12 or so months as a company. Has come a long way, and so it'd be good to really sort of understand, what are you doing? What's the magic that's happening at Biofizz at the moment?
Well, I'm glad to see that people are acknowledging the change and the growth, and I think from our perspective, it's really exciting that we've gone from being quite a one-man consultancy to growing into a team that can really support increase our capacity, but also support a wider range of products with the experience we now have on board. So Biofizz, I think by its definition, is a full-service life sciences consultancy.
Yep.
We're a team that represents an experienced blend of industrial, regulatory and clinical backgrounds. And what we like to do is use our hard-earned experience, and I will call it hard-earned, to help our clients reach their next milestone. So we work with clients at various stages of maturity. For early stage companies, maybe this is an idea that needs to become a concept or a prototype. Or for later stage innovators, this can be a case of we have a product. How do I get this into pilot studies, into the market? How do I, demonstrate my first revenue? So I think importantly, whether you're big, small, young, experienced, we like to build our teams around our clients so we can make sure that we're just as agile and we're just as flexible as you need us to be.
Interesting, interesting. Okay, and so for context, then, what kind of products or customers are we talking about?
So, we can support a wide range of products and services. We do, I think, focus quite a lot on medical devices, in vitro diagnostics. We
Okay.
have some work as well and experience in antibiotic development, vaccine
Wow.
development. But alongside the human health side of things, we have experience in veterinary, food. There is a wide range of experience we can lend just because of the types of skill sets that we've developed and the types of people we have within our organization that, I think it's worth an ask if I was, an innovator or a person on this call is that, how can we help at Biofizz? I'm almost certain that, if perhaps we can't at Biofizz, we know someone within our network who can help you.
Mm-hmm.
So
Very good.
always worth the introductory conversation, I think.
Very good. So I know that a recent addition is your wet labs facility. Is that correct?
That's right. Yeah. So I think, traditionally we've always been a consultancy. So we offer hourly, project-based, or even fractional roles to our clients.
Okay.
Um,
Okay.
but one of the opportunities that we saw was that, we were always referring our clients out to an external provider. Maybe they'd be based in England, they could be based in mainland Europe, who needed either a proof of concept, verification, or validation services. So about 18 months ago now, we invested in our own laboratories. And the intention was, how do we become more holistic? What I've had frustration with in the past is when you work with an external provider who's too far removed, they will do exactly what you've asked them to do,
Mm,
which is what you've paid
mm,
for. But, as a young company, you need to be responsive, you need to be, agile. And what are the things we pride ourselves on here is that if we are doing the working house, we can change that endpoint if that benefits the work package that you're focused
mhm,
on. So, with the two elements, the consultancy and the lab services, we've certainly seen a lot of interest and benefit to our customers who, have that more full service, that all-in-one support that we can offer at Biofizz.
mhm. Fantastic. I think the things you're talking about here about being flexible and agile and being able to build up the team around the customer requirements is, all the signs of a modern business, in my view. I think that, companies over the last few years, certainly since COVID, is that's one of the big lessons, building for resilience.
Mm.
And huge teams that kind of offer massive overheads. You just don't offer that same level of flexibility, I suppose. So it's really good to hear because it means that you can serve the customers in the best way, but also it feels like biofuels are going to be around for a long time as well, which is again that's probably reassuring for your customers.
Exactly. I think, what we do like to pride ourselves on, we're not a consultancy that's there for the tea and biscuits. We're not just going to join your monthly meeting and criticize. We like to be involved, get really passionate about your business, your opportunity, and then importantly, we can take a step back. If your business then focus on another area of development, perhaps there's someone in our team who can lend that experience. But we're certainly not. You know, you know where we are. You can come back and use us as and when you need to. Again, we can be really flexible and support businesses as they grow.
Very good. Very good. Okay, so yeah, time's moving on, and I'd like to leave a couple of minutes at the end just for one or two questions if anybody has got anything to ask of James. But just a couple of other points that I wanted to cover. So I know that you were recently involved in a Welsh government trade mission to the UAE, and I think that you visited the was it the WH
Yes.
Expo. So I'm keen to understand, why did you decide to exhibit there? What opportunities do you see in the Middle East at the moment?
Well, yeah, I think, Dubai, certainly from the outside looking in, looks like a very interesting place. So, during our visit, it was really good to kind of test this vision that we've been presented um, of Dubai with what's there. And I think what I will
Yeah.
admit is that there is certainly an excitement or an enthusiasm to that place. And, that obviously extends to their enthusiasm for innovation. They are certainly, I think, what I would consider a later mover in healthcare, which means that they are able to kind of pick and choose the best of things. What's nice to see is that you can get on a Japanese train, you can, go out and you can see kind of German infrastructure. This is a group that
Mhm.
is building the best of
Mhm.
things.
Mhm.
So, what I can see as an opportunity for our clients is that, there is appetite for new, there is appetite for disrupting, um, and I'm certainly hopeful that, beyond the current circumstances that are affecting the region, that there's opportunity for, a stronger relationship to that place in the future.
Hmm. Interesting. Okay, so I think you alluded to the fact that medtech is maybe struggling to raise investment for product development projects, and so do you? Is the Middle East hampered in the same way? Do you feel as possibly the UK?
I mean, it's an untested from our perspective at this point in time, but we know that, for lack of a better term, the money is there. We hear about huge checks being written for novel innovations, and I think what's really positive to see is that if you do have the right solution, they are willing to pay for it. I
Mm.
think there are some nuances that we were made aware of, in terms of, maybe establishing the relationship. It's quite personal, it's quite social. It may even be, family driven in some instances for that region. So, the relationship becomes key. And I think what we've got to do at Biofizz is learn a little bit more about how to build that relationship, that trust, so that, we can be introducing our clients to that kind of opportunity.
Okay. Okay. Interesting. Okay. So AI, hot topic. It's not going
Certainly
away.
is.
Yeah. So what's your perspective in terms of how your clients maybe using AI at the moment, if at all? What problems do they feel they can solve with AI, or what's your general feeling? What's the feedback that you're getting from the market around the usefulness and application of AI within the medical industry?
Yeah. Well, I mean, one thing I will plug is, Iterate are certainly well aware and sort of, I think, on the leading edge when it comes to AI and its opportunities. But I think a lot of us, and our clients included, come from a little bit more of a naivety. We're hearing about all the opportunity that AI could bring. So I think one of the questions that we get asked a lot is, how can we be using AI? And I think there is a temptation to be using AI for the sake of it. There was certainly a trend where if you had an AI something, it will probably be looked a little bit more favorably or understood a bit quicker by an investor because everyone really, I'll say educated themselves about the use of AI, but it became a very recognizable term. Where does it fit within the med tech and health tech spaces? There's huge opportunities for drug discovery. There's huge opportunities for analyzing massive quantities of data. But one thing I will emphasize, and one thing I see an opportunity for, is that whilst we can create apps and symptom management solutions, there still needs to be a widget or a hardware or a something solution that's feeding good data into the system. I mean, I'm not sure what you've experienced, Gethin, but the temptation to just use AI, using it effectively can often be, maybe a bit more of a time sink than people realize because they're assuming it's going to solve all their problems from day one. Can you talk a little bit, perhaps from your perspective, what a good AI solution could look like, for a young company or the solo entrepreneur? I think is the one of the interesting uses of AI.
Yeah, I think like I say, the temptation is to try and first of all, there's this level of urgency that I think we kind of have to remove from the conversation. And once you do that, it allows you to focus a lot more clearly on where you do apply it. And I think where you do apply it is where you've got problems. And, it's very much considering AI as a tool to be able to solve problems and ultimately accelerate workflows. I think it is kind of like the second aspect of it. So, just dial back the urgency and focus on right. What are the core problems? And starting small and achieving quick wins is a positive way of doing that, because we speak with customers right now that just want to do too much with AI, take on massive projects. And you really do need to start small, like with any product development. Prove its usefulness, prove that you're getting reliable outcomes from it. Understand the level of data that you do need to be putting into it in the first place.
Hmm.
How many data points, what's the volume of data points that you need to be feeding it to be able to get meaningful results? If you're talking about image recognition, for example, is it 10 images that will give you a reliable result, or is it 10,000? Because, that does make a huge difference. So starting small, focusing on problems is certainly, the kind of the key principles, which, might sound quite basic, but they're still very, very important.
Yeah, I think from our perspective, we've certainly seen an opportunity to kind of maybe expand or explore skill sets that you don't have in house. You know, obviously we're not using generative AI for our marketing or to create, branding opportunities, but they're a really good, useful way for someone, who can't draw or can't color in, such as myself, to kind of say, well, what would it look like if we did this?
Yeah.
Before going to someone like Iterate, and then having a bit more of a concrete idea that we can talk about before we have that really tangible product. I think I certainly see that as a good way to make yourself seem a little bit more advanced than you are. But I think, yeah, importantly, you need to go back and fill those gaps, to have a product that is going to, have any kind of impact.
For sure. And, what you just mentioned there is we're definitely seeing that as a common pattern now. Clients would often come to us with just a problem and a very, very loose solution of how they thought they could solve that problem. Now, we're receiving full detailed project briefs, a range of different concepts that they think could solve the problem. And so it's allowing customers to start their project um, in a more informed way, and
Mhm.
to a certain extent further on that development process, which is good. Even at the early stages of the design process, it's helping our clients accelerate their development.
Mhm. I mean,
Definitely.
interesting question. I mean, do you still see a role for consultancies like ourselves? In a couple of years' time, what is the role of a Iterate or a Biofizz, with the rise of AI?
Yes, there is a role. For sure. Um, there's a role for those consultancies like Iterate and Biofizz who do use AI within their workflows. Where we will see the reduction in competition is those businesses that fail to adapt to using those tools. And there will be lots. There will be lots that don't engage with those tools, that want to remain kind of aligned with traditional ways of working. And I think that that's where we'll see businesses becoming uncompetitive. So at this stage it's about being adaptable, learning how to use those tools, identifying how you can accelerate workflows in your company using AI, and that will at this point stand you in good stead. What consultancy looks like in 5 years' time, I don't know. What the world looks like in 5 years' time is, another broader question that that everybody's speculating on. So, it's about, for me anyway, remaining engaged and flexible.
Hmm. Yeah, sounds good.
Okay, right. We're a little bit over. Just wanted to open the floor if anybody has got any questions for James. There may not be. I can see there's a few people that have dialed in today. Very grateful. Chinny, Philip, Vigil. Thanks very much, Alexander. Thanks very much for joining. Has anybody got any questions for James before we close the session?
Yeah, hi. Good morning, all.
Morning, morning.
Morning.
Yeah, first of all,
Welcome.
thanks, Gideon, for inviting me.
You're very welcome. If you
Yeah,
if you
yeah,
got a question for James,
yes, please. Yeah,
go
so
ahead.
I saw that may I know about the materials that you're using for this product, and can you show how this would be working? The thing why I say this product is great is I right now have a kid who's just 1 years old, and we are now struggling to give the medications.
Hmm.
She don't really like this to be fed by spoon, but with a special syringe we got it with a medicine which is actually flat. We have to pull it and just stuck it into her mouth. Then
Hmm.
that is the same syringe we would be using for most of the medicines.
Hmm.
So can you explain the working of it and the material and all the details?
Yes,
This yeah,
certainly.
the syringe.
Yeah, and I think one of the, I also have a small, a young one, 10 months old. Yeah, causing problems in the best way, I think, is the best way to summarize it. But, again, this was something that we wanted to make sure that we spoke with parents such as yourself to get feedback. And one of the things that we can point to, is just the tapered end of the tip. It's obviously very uncomfortable, and I think there is a size difference between, an adult taking a syringe and a small
Mhm.
child taking a syringe. And
Yes,
we, had a lot of feedback that a lot of children are more likely to accept it if it goes into the cheek as opposed
stick.
to
Yes,
sort of touching the tongue and sort of
yes,
triggering that kind of, ejection response. So again, it's more about understanding, or we had to understand, you know, how is the best way to, get this into a baby's mouth without them, spilling it. Another thing was the importance of this wasn't a, single, press a button and it'll constantly, eject the flow rate. The ability to stop, the ability to sort of take it apart, store it for later, and maybe come back to that dosage. Because children, as much as we'd like them to sort of just take 5 mils all at once, if you've got to dose this, 3 or 4 times over a 10-minute period, Dose Doctor allows you to do that. So I think, Vigil, there is a couple of, really interesting design uses that could be a benefit to yourself. And we're open as well to learning more about what works and what doesn't. So maybe some feedback from your little one would be really impactful.
okay. Will it be possible for you to can I try that a prototype of yours?
We can certainly share something that we've been working on, yeah, and perhaps you,
Okay,
like I said, there is some the fidelity of it. Maybe we have to speak about, but why don't we, drop us a line after the call and we can arrange
okay,
maybe
sure.
some early access.
Okay, yeah, sure.
Yeah, that sounds good. We've got your email address from your booking, so I'll tie you up with James after the call.
Okay,
Right. Thanks for your question, Philip. It's good to see you.
Good.
See you have your hand up.
Almost see you. Yeah. Hi, Gethin. Thanks ever so much for another great session. And James,
You're
really
welcome.
interesting
Thank you.
lessons and story. If there were one thing that you were concerned about before engaging in industrial design practice to help with your project, um, is it possible you could say what it was and how was that concern overcome?
Good question,
Yeah, I think one
James.
thing that we were unprepared for actually was sustainability. And this was actually a question posed to us by a series of investors. When they took a look at one of our original concepts, was this looks like a single-use plastic, and that really threw us because we were, uh, to be fair to ourselves, this was just an idea, this was just a concept. We wanted to prove that it worked, that it was robust, that you know, it was working before we focused really anything on sustainability. One partner that was part of the project I didn't mention was actually the AMRC, and we gave them the responsibility of actually, helping us understand. And I think understand is the important word I think I'd share there because we didn't know what we didn't know. We knew that we could use more sustainable plastics. Maybe we could use, less material, but we really didn't want to impact, or give ourselves additional hurdles to jump over if we used an alternative to polypropylene, for example. Um, where the AMRC really came in and helped, they actually helped us conduct a life cycle analysis. Now, obviously, we weren't, cradle to grave at that point, but it was only done at cradle to gate. But it was really good to give us a line in the stand so that we could understand, okay, here's where we are now. We need to be showing improvements to, the amount of CO2 we were using. Maybe our supply chain needed to get leaner. There were lots of pieces of information that we could then begin to investigate further without being inhibitory to the limited resources and budgets that we had. I think, Philip, the only concern I think, and a lot of people will have this when they start this journey, is I have a finite amount of resource. How do I best spend this on a project to get to where I need to go? And if you ask someone that they want to just focus entirely on sustainability, you might have some really good ideas, but might not end up with a tangible product. So finding that balance, I think, was key, and something we'll be taking forward to other client projects as well, just so that we can help people remain informed and aware of what is now becoming an important part of design. The sustainability, or that kind of the impacts of products.
So it's added to your knowledge as well as a result of this experience. That's really interesting.
Yeah, really now aware of what needs to be done. I mean, I won't lie. When we first had that feedback, we were a little bit skeptical, in terms of, is it fair for for lack of a better term, a startup to be solving these problems when we don't see that kind of scrutiny for the incumbent technology? But, there are plenty of good examples. Ben and Jerry's, for example, high emphasis on sustainability. They then become market leaders. So, there is certainly a role and a badge that you can wear. Beyond like the traditional B Corp certification and some of those other kind of practices, there are things that you can be doing in your business that help you stand out and show that you've really thought about the entire product design cycle.
Brilliant. Thank you.
No, thank you for the question.
Okay, right. We will wrap up there if there's no other questions. Thanks for everybody that's attended today. And James, thanks very much for your time. Another really good discussion. It's appreciated.
Thank you.
You're welcome. You're welcome. So we'll be back with another episode of Industry Insights on the 23rd of April. It'll be an afternoon session, 1 p.m, and we will be talking to Professor Laurie Rowe from Red MedTech. So that'll definitely be an interesting discussion that I'm looking forward to having. So again, yes, James, thanks for your time, and we'll catch up soon. And thanks all for joining. It's appreciated.
Thanks, everybody.
Thank you.
Now. Bye-bye.
Thanks all.
Yes.